Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. In today's video, let's explore how you can manage and heal psoriasis with natural and effective therapeutic tools. Psoriasis is quite a common skin ailment, and yet its causes are not clear yet. In my clinical experience, it has everything to do with a leaky gut syndrome or a weakened microbiome of a gastrointestinal system, hence the affinity of being an autoimmune disease. So let's explore how you can heal this uncomfortable skin ailment and also elevate the quality of your life. Enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. Thank you so much for your thumbs ups and your likes, as they do help the growth of my channel. And lastly, have a look at my website, medicanova.net, at the online academy, where you will find comprehensive, certified, university standard home study online courses in homeopathy, mental health, health and wellness coaching, quantum healing, and so much more. And if you want to reach out and just have some questions, contact me at health@medicanova.net. So what is psoriasis? Psoriasis is a chronic, sort of autoimmune skin disease that causes inflammation and a scaling of the skin. Now, skin cells normally grow and shed sort of like every 28 to 30 days. And in psoriasis, the skin cells start to grow more rapidly, maybe every 3 to 5 days. So the skin cannot shed the excessive cells as quickly as they appear on its surface. That's why we have this thickened skin appearance. The result is a build-up of cells on the skin, and we refer that as a plaque. Now we know that psoriasis begins in the immune system and involves a type of white blood cells. We call them T cells. Now when you have psoriasis, the T cells are put into action a little bit by mistake and become overly active, way more than they're supposed to be, and leading to unhealthy swelling and a fast turnover of the skin cells. The psoriasis symptoms and the causes can be quite tricky to determine, so it's more of a complex situation. And on top of it, we have various types of psoriasis. And also the psoriatic disease in itself can lead to complications. So what I'm trying to say here is psoriasis, it's not just a skin disease. It's expressed through your skin, but there's much more to it. And in this video, we want to explore this. And that's why it's so important to recognize your signs and select also the most individual, targeted treatment plan here, and not just choose a one-size-fits-all sort of solution. Let's talk about the different types of psoriasis. We have plaque psoriasis or psoriasis vulgaris, which is the most common one. And I put some pictures up, and yes, I was very careful selecting pictures or images which you can, stomach to look at, because it's an, unsightly skin ailment, and so you want to make it still accessible. Now, this kind of psoriasis is mostly found on the knees, the elbows, the lower back, and also on your scalp. Another form is called Guttate psoriasis. And unlike these large raised lesions common associated with this plaque psoriasis, Guttate psoriasis is characterized by these small dots and seen frequently more in children or young adulthood. And this kind of psoriasis can also be brought on by an event of a strep throat infection. and then it can lead to psoriasis. So that's something to remember, right? And I had this quite often in my practice that even adults say, I can vividly remember that this whole thing started after strep throat. Another type is called inverse psoriasis, and here you see the psoriasis more in the body folds, so maybe the inner elbow or behind the knee. And I put a picture up here too from a baby, so it's quite sort of like a smooth sort of appearance, shiny red areas. They're called inverse psoriasis and usually found in the folds. Pustular psoriasis, as the name says, pustular means bumps, and they look like blisters, a little bit like pimples, but they're actually filled with white blood cells. And these pustules are usually surrounded by red skin. Most frequently appear on the hands and the palms or on the sole of your feet. And then we have the really strong one. It's called erythemic psoriasis, the most severe, type of psoriasis, usually found in people who have an unstable plaque psoriasis. It's known by this wide viral outbreak and is accompanied by a lot of itching, a lot of pain, layers and layers of skin. And here the skin comes off in sheets. So yes, you wake up in the morning and your whole bed is full of skin pieces. Some cases, particularly if they're left untreated, it can lead to loss of protein or even bodily fluids. There can be a lot of shivering involved. Even it can lead to pneumonia or congestive heart failure. That's where the complications come in. This is not the video, for this. Here we want to focus on psoriasis vulgaris, Guttate psoriasis, something which you can manage, because if you have the latter one, it's like you end up in hospital by now. So let's keep it accessible and always, back it up with your healthcare practitioner or contact a professional homeopath. Conventional treatments for psoriasis are helpful and they might work, but because it's an autoimmune disease, it doesn't really hit the core, the heart of the disease. There are natural remedies on the market and for you also accessible, and they're quite effective. And here I want to share that with you. But let's go back a little bit to the understanding what psoriasis is really about. So what are the symptoms? Psoriasis is most often found on the elbows, the legs. It can be on the scalp, the lower back maybe, can be on the face, the palms, the sole of the feet. But it also can affect other parts of the body, like your nails, like your fingernails, your toenails are affected, even the genitals, and sometimes you can see it inside your mouth. That has a lot to do with yeast infections as well. So we have a lot of plaques of red skin, sometimes also covered with crusts of scales that tend to be more silvery or white in color. The spots are usually quite well defined with the borders. Talked about loose skin. The lesions can be very itchy, painful. It's like it's a really skin ailment which gets under your skin, literally talking about. Sometimes we see dandruff of the scalp, of course, scalp psoriasis, and believe it or not, 50% of the ones who are affected by psoriasis also experience scalp psoriasis. Cracked, discolored skin, sometimes it can easily bleed, you can see bruises. Discoloration of the fingers and the toenails, and also the growth of the toenail can be affected. The toenails can be quite thickened and deformed. They can even bleed, right, in that sense, or the nail bed raises and detaches itself. needless to say, people who experience psoriasis really, have depression or anxiety. It's understandable, right? Here in the Northern Hemisphere, we have start of the summer, and everyone wants to run around with shorts and a summer dress. And somebody who has psoriasis, for example, on the lower knees or on the shin area, it's embarrassing, and it really causes them to constrict rather than embrace life. It just affects the whole quality of one's life as well. On top of it, it has this sort of like come and go pace, right? It relapses and then remitting phases come about. There are complications attached to it, maybe psoriatic arthritis, uveitis. It can affect your eyes with conjunctivitis even. And then we see it also in type 2 diabetic people, and also others who have maybe kidney problems. As I said, it's not just a skin ailment. What are the causes? Today we know that the body's immune cells are affected and they target the skin, leading therefore to these scaly eruptions. If there's psoriatic within your family history, right, if there's a positive history in there, you may be more prone and susceptible to it. And we also know now today that certain triggers really aggravate psoriasis. So in this case, stress, needless to say, obesity, extra weight gain, smoking, and as I mentioned before, infections like strep throat events. But usually we're going to talk about this overactive immune system. As I said, it's an autoimmune disease. Poor diet is the top of the list, and don't belittle that. Has everything to do with a leaky gut syndrome, and as I said, a weakened microbiome, which are it is the bowel flora within your gut. And we talk about this in a minute more in detail. So we have this abnormal small intestine permeability, which means your gut lining is porous, and food or toxins can go in and out into the bloodstream, and that's not great. So the body starts to react. That's where autoimmune disease truly has its sort of roots, right? That's really what we want to look at. We don't want to just look at vitamin D deficiency, which could be part of that because autoimmune part, but it really has to do with your guts. Increased number of T cells in the blood, the dermis and the epidermis. You maybe have difficulty digesting protein, so we're lacking digestive enzymes here, right? The carbs, the amylase, the lipase, which is responsible for the oils, and protease, which is responsible for the breakdown and assimilation of protein, is not working here. Needless to say, hormonal changes can be a big part here. I talked about the genetics. And don't forget your liver, right? If the liver is weak, it cannot combat the onslaught of the toxins and really make sure that your immune system as well as your detoxification channels are functioning well. So when it comes to conventional treatments, doctors, of course, take into consideration, the size and the type of psoriasis you have, and that also determines the treatment plan. Most of the time, you maybe get offered retinoids or immunosuppressant drugs externally, maybe some creams and oils or steroids, hydrocortisone cream, all of that. And I'm not saying it doesn't help, but it doesn't address the core, the heart of the whole situation here. And I'm a healthcare practitioner who is interested in the mind-body connection as well. And I want to know how can I, sort of create lasting effect, a lasting healing, rather than just a sort of, I'm sorry to say, a Band-Aid situation. If you're interested in a health consultation, either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. As with all of my other videos, I always want to lead you and guide you and inspire you to come back to yourself. So here we talk about the food for thought, or the metaphysical meaning about psoriasis. So the body is starting to express sort of an extra shedding of something, right? But can't sort of align itself, can't balance. And I want to see, as I said, what is triggering you on the mental, emotional aspect. Maybe it resonates with your heart, and I hope so. To find out how you can help yourself on a deeper level as well and change the behavior of your cells. The drugs won't do that, right? They're even changing or let's say targeting a really effective program for your leaky gut syndrome. It helps. But your mind and your emotions are the ones which really affect the behavior of your cellular system. So you want to change it, because every 120 days your cells die and a new generation is born. So you want to bring in a fresh, a clean slate of information, of DNA information, to the next generation of your cells, so they know how to do it better than the previous ones. But that can only happen if you give the input, the right direction, right? And not being sort of hampered and burdened by maybe wrong created or instilled belief systems. So let's explore this a little bit. I always refer to Jacques Martel's references, and he says psoriasis consists in an overproduction of cutaneous cells, we know that, creating an accumulation of dead cells, a thickening of the skin, right? That's what we see. A thick red plaque covered by fragments of whitish horn substances. Sounds like a horror story here. If I have psoriasis, I'm among the 2% of the world population who have this disease. So he says I'm generally hypersensitive, skin deep, right? That already gives us a little indication, a keynote here. And I have a great need for love and affection that's not filled, possibly reminding me of another difficult period of my life. And at that time, I probably experienced a very great feeling of abandonment or separation from someone or something that was very dear to me. Psoriasis implies that there was a double separation, most often from two different persons. So it can be a double separation from the same person, or it can be maybe from a parent and a child, or any of that. Why? Because we have layers of skin, right? It's like we're not talking about one aspect here, we several aspects here, and that is expressed also on the organ of the skin. So it is the skin that is touched because of me. Being a child, what I need the most is a physical contact with my parents or with another person whom I love and feel close to. Now, this double separation may have been from my mother, or one of my brothers or sisters, or from my spouse, and a project at work, which is so some like their baby maybe, or any other combination involving a separation from two persons or two situations that I love and greatly value. I may feel forced to have unwanted contact with other persons, and the fact of being or feeling separated prevents me from having this contact, especially involving touch, and therefore my skin with this person's I love. So the reunion is impossible. And then psoriasis will appear. I am now so afraid of being hurt that I want to keep a certain distance between myself and others. Psoriasis is like, oh my God, don't touch me, right? Or I don't want to be seen, or, I'm really embarrassed about it. So you really create some barriers with your external world. I want to avoid losing face. Psoriasis is a clever way that my body uses to protect myself against too much physical closeness and protect maybe myself against even my own vulnerability. I'm therefore experiencing an inner conflict. There is an ambivalence, right? Should I go after my needs, or should I go after my desire? What's going on here? And it almost feels like that you feel misunderstood by others as well. I must therefore free myself from certain mental patterns and attitudes that have accumulated and now no longer have any reason to exist, being burned out and dead. I have repressed my emotions so much that I live in permanent anxiety, and I control my life well enough up to the point where I must face my own emotions at this point. So in my practice, Medica Nova, it's not unusual that I've seen patients, for example, who have this belief system of perfectionism. They really have to do well, high expectations. Either they were instilled by their upbringing, their parents or their peers or, school or teachers, whatever. But there's this feeling like they're never good enough. They never reach their standard. And this anxiety and this restlessness, this inner questioning is affecting the psoriasis. And it gets worse, or the attacks or the outbreaks definitely appear when there's heightened stress, pressing sort of like with a finger on this particular belief system. So explore a little bit. What's going on in your life, right? What is the double separation aspect here? Do you feel separated from your spouse? Do you feel separated from your child? What about your work environment, right? Do you have to juggle? And do you feel there is an ambivalence? I don't know what to do next. And then your skin ailment gets worse. So what would be the positive affirmation here? To start with, I think it's very important to accept that you are sensitive, that you are vulnerable. And, it's like when somebody says something, it does matter to you. I learn to do things for myself, not only based on what others expect of me. You are enough, and you always meet your high standard. It doesn't matter if it comes from the outside or, you do your best, and that's really what counts here. And although psoriasis probably occurred after a painful event or an emotional shock, I accept it as part of the natural process of living and growing in order to become stronger and more solid inside. I come to terms with each of my emotions, and I learn to trust myself. I dare to take the risk of opening myself up to others so I can receive the gentleness of contact. You maybe, are not ready to have these big bear hugs, but hey, a nice handshake will do first, or a little pat on the shoulder, right? There's nothing wrong with stating your boundaries, but also being open-minded and open-hearted to receive. So by being in contact with what goes on inside me, anguish gives way to trust in myself and in life. Taking care of yourself is key in this crazy world right now. It starts with your diet, but it also starts with your relationship to life, to the events you experience, the triggers which set you up. And then try to find a place within where you become very still, where you embrace peace, contentment, and that you start really loving yourself and say, hey, I'm enough, I'm okay, right? There's actually nothing wrong with me. And, the body will respond. There's no way. Your body is directly linked to your soul. In fact, the body is an extension of your soul. I wrote about it in my book, The Dance of Your Core Healing, Transforming Your Mind, Body and Soul in the New World. It is clinical proven today, scientifically researched, that the body is an extension of your soul, and you have direct access to that each and every day. So explore. If you have any questions, contact me at health@medicanova.net. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths in achieving the very best of you, contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. So if you're still with me, let's talk about natural treatments. For decades, studies have been looking at the link between intestinal structure and the function and the development of psoriasis. In the beginning of this video, I said in my clinical experience, it has everything to do with leaky gut syndrome and the weakened microbiome. Some experts believe that psoriasis is actually caused by this intestinal permeability, the leaky gut syndrome, especially in the area between the duodenum and the jejunum. Now, consequently, the body seeks to eliminate toxins through the skin. And in this model, psoriasis represents the body's desperate attempt to cleanse itself. Now, if you slap on creams or cortisone, it's just going more inside. And do you know that the next organ in line in the toxic stress cycle model would be your lungs? It's why, respiratory situations maybe come to the forefront if you start suppressing your skin eruptions. So it's absolutely important to adapt a new diet. 100%. It's crucial here. If you have a leaky gut, then partially digested protein and fat that seep through your intestinal lining, making their way into your bloodstream, are causing allergic responses. The skin eruption is basically an attempt, it's an expression of the body to get rid of these toxins. If left unrepaired, it can lead to more severe health issues. Psoriasis is linked to depression, anxiety, to migraines, to headaches, to muscle pain, as well as to chronic fatigue. Even thyroid affinities, Hashimoto, all of that has all to do with your gut. So studies have shown a link between abnormal small, as I said, intestine permeability and psoriasis. So to heal your gut, you need some supplements, you need some new guidelines. The first one is you want to bring in probiotic food. Consuming foods high in probiotics is a great way to support your digestion, remove the toxins from your body, help reduce the inflammatory aspect, and boost your immunity. Right? We talk about organic, raw, cultured dairy like kefir, yogurt, cultured vegetables, and so on. Have a look on YouTube here. There are many resources about probiotic foods. High fiber foods, foods high in antioxidants, also foods high in zinc would be very advisable here. Foods high in vitamin A, that is all, the vegetables which are, screaming to you and saying, orange, the color of joy, right? The yellow and the dark leafy greens, go for that. Of course, if you want to bring in more animal products, wild-caught fish like salmon, mackerel, herring, because they provide the omega-3 fatty acids, which are so important for your skin, as well as the vitamin D. Needless to say, learn how to reduce your stress. How to do that, God, it needs another video. But if you're into cognitive behavioral therapy, if you are into sports, if you are into mindful practices, it can be Qigong, Tai Chi, the sky's the limit here. And, share it. Put it in your comments. Let me know what your choice is to effectively heal yourself. Because if you do that, you inspire others as well. So your comments help the world. Exercise. I mentioned that about drink a lot of water. Really get your fluids intake happening. Also, I want to say take bath, and in this case, Epsom salt bath. It's like really helps the itching, the inflammatory pad. Maybe oats, soak oats in a little sort of bag and or rub it onto your skin. It really helps the itching, removes the scale. You can also apply topical creams, and you can find them on Amazon. I mean, it's so accessible. Oregon grape, 10% cream, I can recommend here. Also, avocado or vitamin B12 cream. Aloe cream, usually 0.5% because it cools down the itching parts, but sometimes aloe can dry out the skin. So you want to maybe afterward bring in some coconut oil. On the market you find a cream called Soria Flora. It's a homeopathic cream from the manufacturer Boehringer and Tafel. That helps as well. So you can do a lot. Chinese traditional medicine, herbal formulas as well as Ayurvedic formulas are wonderful here as well. I want to share with you some natural products which you may want to explore. Hydrochloric acid, which is related to your stomach. You need this in order to break down the toxins and the bacteria which happen in your stomach. It helps with the protein digestion and decreases the psoriatic flare-ups. I mentioned omega-3, fish oil, wonderful. I would say 1,000 to 2,000 milligrams. It helps with the inflammation and can aid in the healing of psoriasis. You don't want to forget vitamin D3, and that is about 5,000 units daily, because that's associated, of course, with your autoimmune situation. And needless to say, probiotics, and we need a lot, at least 50 billion units daily. Improve your digestion by increasing good bacteria, crowding out the bad bacteria. And here at Medica Nova we use very specific products. For example, we have a derma colonizer, which you can literally put on your skin, and it's a sort of like gut skin microbiome. We also use aloe vera, and then also a product called Skin Biome, where we provide key bacteria strains that improve actually the microbiome of the gut skin and calm down the psoriatic flare-ups. Again, we talk about Skin Biome. Can be combined with derma colonizer. Again, it's related to your dysbiosis of your gut. And also we often think about cellular glutathione, which is the best antioxidant here. It shows to lower the inflammatory part associated with psoriasis. So if you want to know more information about it, contact me at health@medicanova.net. But lastly, let's talk about homeopathic remedies, because that really targets a more individualized treatment plan, and that's what you want. Homeopathic remedies here are very safe, they're reliable, and it's sort of like, I love it. Of course, I do it over 25 plus years, every single day, and I can see the results. It's free of side effects. and a majority of cases can be actually treated just with homeopathy alone. They can be used by people of all ages, and they work by moderating also the overactive immune system. That's what we want here. The initial aim is to, of course, manage the itchiness and the burning sensation and the amelioration of the eruptions, but also it really goes deeply in preventing any complications. Maybe your joints are affected by then, or we really look at the nails, what we can do. So it goes much deeper. For more information and guidelines, it's really important that you contact a healthcare practitioner, a professional homeopath, and contact my practice, Medica Nova at health@medicanova.net, and book your appointment. I think that's the best way to go here, because then I can help you to really find your specific match of a remedy. But the most common remedies are, which I'm sharing with you in this video, you can actually get in your health food store or even online. Sometimes, how to use this remedy is a little bit difficult. It's summer, so next week I will be traveling to the UK for a whole month, and I'm gonna probably make a sort of like live video about how to use potency or remedies. So, because that's usually a confusing subject here with homeopathic remedies, but let me give you some gists. So the best remedy is called Arsenicum album, and I would do potency 30, that's the number behind the name. And the keynote here is silvery scales. So if you have these dry, rough, the red pustular eruptions, what you talked about it, but there are a lot of scales involved. As I said, silvery color maybe. Usually they cover most of the body, except the face and the hands. That's interesting with psoriasis. Think about Arsenicum album. The eruptions spread quite rapidly. There's a lot of itching involved. Cold usually worsens the itching, like, putting some ice on it or even a cold shower, while warmth application relieves it. There can be bleeding spots because, you start scratching. And personality-wise, these people are quite restless. There's anxiety involved. It's like, it just makes it all worse. So, but, it's a good remedy to think of. It's also indicated for Guttate psoriasis. We talked about this small rose-colored spots, right, with the scales. If you have a cracked skin, right, so it's not the scales, but the cracked skin, which is often moist, has a sort of honey sticky fluid coming out. You see it often on the scalp. Graphite 30 would be a fantastic remedy here. Usually for dry, rough skin with scales as well. But you see these deep, deep cracks. And there is, as I said, it's a wet eruption, a stickiness coming out. Great for scalp psoriasis, but in such cases, eruptions with scales appear also on the scalp. The scalp may be very sore to touch. And there's a burning sensation even on the head. It can even spread sort of behind the ears, and that's really the typical location of this particular psoriasis eruption. Sort of behind the ears, it gets very moist and crusty. The nails are affected with graphitis. Particularly, it's quite rough, it's thick, it's deformed. Graphitis is a fantastic remedy here. I would also use it for fungus of the nail. So again, potency 30. Now, how many times would I do it? Well, if it's really strong in adults only, of course, I would take it 3 times a day. Do it maybe for 10 days or 2 weeks, and of course, as I said, look out for help. But that would be a good start. With children, of course, one need to take the case and see what the age is and what the diet is. If you have this large shedding of the scales, right, where the bed in the morning is full of skin sheets, it's gross to talk about it, but it's good to talk about it, because then we can find a healing modality. The Remedies are Semicomiodine 30. I had fantastic results with that. And there's this shedding of large scales from the skin. The skin is covered with inflamed patches with scales on them. And there's persistent itching patches, and the shedding of the scales leave even the skin raw, right, underneath. So it starts all over again and all over again. Semicomiodine, fantastic remedy. If you have just the symptom of itching and burning, and not so much the scales, but you just want to calm down the itching, sulfur 30, great remedy. Violent itching lesions, we talk about it, and the person goes on scratching the skin until it bleeds. Burning sensation, the itching is wandering, changes place frequently, but the skin is quite rough, scaly, but mainly itching. Definitely gets worse at night because the warmth of the bed or even a hot shower makes it worse. And the sleep is disturbed, right? Because there's this constant itching and this burning sensation. We talked about cracks, right? Graphite was a great remedy here. But if you have deep cracks, particularly on the palms and the inside of your hand, we talk about Petroleum 30. Deep cracks, burning sensation, intolerable itching, bleeding may also be present, very much so, and the skin is intensely sore, painful, hard, fissured, maybe, the skin is quite thick, particularly on the palms and the inside of the hand, and very slow to heal. I've seen in women with hormonal changes, particularly at the back of the scalp, sepia can be indicated here when you see large oval lesions or patches. They're quite circular in shape. Graphite is a great remedy too if it's more wet, particularly at the margin of the skull and the hairline. But sepia is a great remedy here for that. Big oval lesions of the skin. The lesions usually are reddish, papules, can be isolated. Shiny whitish adhesive scales present, on the papules. Of course, it's itchy. They can be even on the face. So of course, psoriasis, usually doesn't affect the face, but it can here. Chest, back, arms, and legs. As I said, it's a superb remedy when you have psoriasis at the margins of the scalp. In my understanding, works every time, especially with women with hormonal issues. And then we have the scalp psoriasis. We talked about graphitis, but I think Mercurius solubilus would be fantastic here as well, particularly if you have abundant white scales. The base underneath the scales is quite raw, on the scalp. It's almost like, the skin is shedding rapidly and then reforms again and again and again, and you just keep scratching off the crust. Intense itching definitely gets worse at night. And the skin of the scalp, of course, is very, very sensitive to touch. You maybe also experience some excessive sweating, and the sweat may be a bit smelly, quite sour. And if you have strong scalp psoriasis, your hair may be affected, it maybe falls out, right? And that can be part of it as well. We talked about complications, that psoriasis can even affect your joints. And here we have a remedy called Toxicotendrum. It's particular for joint pain. And here the joints are quite painful and stiff. The pain is worse when at rest, and periods of inactivity. You get up from the chair and it's really painful, but continued movement makes it better. Usually it's worse in the morning, getting out of bed. Exposure to cold air can make it worse. Massaging makes it better. But you can see, in order to find a true, lasting, effective treatment plan, I'm interested in your individual symptomatology. Not just a general sort of kaleidoscope of symptom, but I want to know what's your mind, what's your emotion, what's your physical symptom, and then find and create a wonderful, effective plan which works for you, right? Because you are unique. Of course, homeopathy offers many more remedies indicated for psoriasis, but in this video I just want to give you a brief overview. We have, for example, Psorianum. It's a remedy when you have psoriasis which gets worse only during winter time. Right? That is specific. Or if you have this discoloration on the skin, it's Calia arsenicum. Antimonium crunum is a wonderful remedy for you have this psoriasis of the nails. I've seen phosphorus working, especially when you have psoriasis on the shin bones or the elbows. If the liver is affected and you have only psoriasis on the hands, then maybe Lycopodium clavatum is indicated. You see, you have to find your specific makeup and then it works. So I hope this video has inspired you to seek out more natural solutions. For more guidelines and also to schedule your appointment, contact me at health@medicanova.net. And lastly, have a look at my website, medicanova.net, at the online academy, where you will find comprehensive certified home study online courses. If you ever want to know more about homeopathy and how to apply it, for your family, for your loved ones, even for your pets, and hopefully for yourself. If you want to know more about health and wellness coaching, what are the principles, what are the methodologies, how to be a better coach. You want to learn more about integrated mental health, right? How to meet Alzheimer's, depression, and anxiety, so prevalent today in this changing world. Mental health is now at the top of the list in terms of health, status and how to meet this, because since COVID, right, suddenly the world has changed, and COVID wasn't easy period for all of us because people lived in isolation, in separation, went through a lot of emotions without having an outlet. So of course mental health challenges are now at the forefront. Quantum healing, if you want to know more about it, if you're ever interested in reading a book, it's called The Dance of Your Core Healing, Transforming Your Mind, Body and Soul in the New World. It is available on Amazon or also at my website, medicanova.net. So till next time, much love, and I see you soon on my holidays. Take care.